As a nurse, I have encountered many post-surgical patients in need of wound care after a hip or a knee replacement. Surgical staples are among the most commonly used methods for closure of surgical wounds or trauma injuries. The procedure of removing staples takes specialized equipment and skill by a healthcare professional to decrease additional scarring. It is important to understand the proper way to remove staples to decrease the amount of pain and decrease the risk of infection that is exposed to our patients. So some background information was, according to OpenText BC.Clinical Skills, dehiscence is a mechanical failure of wound healing when the edges of the wound tend to separate during staple removal. According to BMJ.com, the risk of developing a wound infection is 4 times greater with staple closure than with suture closure. So it is important to understand the proper way to remove staples to ensure that those numbers are decreased and we can decrease the amount of infection. Inspection of the wound is also important to ensure that the wound is healing properly and that the staples are ready to be removed. According to Livestrong.com, removing staples too early can cause the wound to open. So I'm going to show you today how to properly remove these staples, and some materials that we are going to be needing is a sterile staple removal kit, a sterile dressing tray, which we can use this, a non-sterile gloves, normal saline, and steri strips for when we remove the staples. So to begin the procedure, we are going to perform hand hygiene. We are going to add all our items to our sterile field. So we would open up the kit and our steri strips. At this point, we are going to apply our gloves. We are going to remove the wound dressing, the dressing on the wound. This is an abdominal wound. We are going to remove the dressing very carefully. At this point, we would also inspect the dressing for any drainage, any pus, any signs of infection. Again, we are going to remove every second staple to ensure and make sure that the wound is not going to open. So we can start at the second one. During this procedure, the extractor staple remover, this is the bottom part that is going to go under the staple, as in here. At this point, we would also inspect the wound, make sure there's no drainage, there's no redness, and there's no pus. Minimal redness is fine. That means that the wound is healing. So again, we would, for the purpose of the video, I'm going to turn it this way. We are going to go to the second staple, place this gently, close it, and we are going to move side to side until the staple is removed. And we can continue with the second one. Every second staple is what we're going to be removing. At this point, we look at the wound and make sure that it is healing and it is not opening. Again, we go under, we close gently, and we pull from side to side. At this point, we can go ahead and put the steri strips where we have removed the staples. Take our steri strip and we place it down. Again, at this point, we are just inspecting the wound, making sure that it is not opening. And we place our steri strips. If everything is going fine, we can remove the rest of the staples. Again, from side to side. Again, going right under, gently closing and moving from side to side. Here we are. We're almost done. Side and so on. Again, at this point, we would replace where we have removed the staples and put steri strips. This wound is left open to air. Also, I do have an example of a properly healing wound, so you can take a look here. This wound is healing properly. The staples do not have increased redness. There's no pus, there's no drainage. This wound here is not healing properly. There's a lot of redness, there is crust and pus. So again, it is important to remove staples carefully and properly to decrease the risk of infection, minimize the scarring, and inspect the wound. Inspecting the wound takes a lot of practice. It is important to understand the healing wounds with non-healing wounds. Staples are removed within 7 to 10 days, so understand that if the wound is not ready to be manipulated and the staples are not ready to be removed, it is important you tell the doctor, you notify somebody. If staples are removed too soon, the wound may reopen and cause additional complications. So again, I hope you guys have learned a lot from this video. Of course, after we would take our gloves, perform hand hygiene once again, and I hope you learned a lot, and I want to thank you for watching.